Hello, and welcome to the State of the Science Conference of the Center on Knowledge Translation for Employment Research. We are very pleased that you have joined us and hope that you will feel free to interact with us via our online format. I'm John Westbrook, Director of the Center on Knowledge Translation for Employment Research, often referred to by me as KTER, and it is located at CEDL, SEDL, in Austin, Texas. This conference has been planned to highlight the current status and learnings from the KTER Center work to date. In addition, our invited presenters for the conference highlight areas that complement the project's scope of work and areas of learning. We began the work of the center in October 2010, and we do plan to continue the project's work into 2016 via no-cost extension. So, even though there is more work for us to do and more results to analyze, we wanted to bring you some of the exciting learning from the project's work to this point. Clearly, we will have more to share with you as time goes on, so please stay tuned. As orientation, the work of the KTER Center has dual purposes. One purpose involves assessing, describing, and informing relevant stakeholders about the current research base related to improving employment outcomes for persons with disabilities. Today's employment rate of individuals with disabilities is described by Senator Harkin, whom you will be hearing from later this morning, as shamefully low. The second purpose of the KTER Center is to explore and actually test through research knowledge translation strategies that may be effective in increasing the appropriate use of that information among key audiences. So you might ask, who are those key audiences? Well, the major target audiences of the project's research activities include policymakers, vocational rehabilitation professionals, individuals with disabilities, and employers, or as they often like to be referred to, business leaders. Clearly, these groups represent key roles in improving employment outcomes. You will notice that we have used these four audiences as a way of organizing the agenda for this State of the Science Conference for you. Today's portion of the conference focuses on policymakers and vocational rehabilitation professionals. Tomorrow's continuation of the conference will focus on individuals with disabilities and employers or business leaders. CEDL is conducting the KTER Center scope of work in partnership with our colleagues at the Virginia Commonwealth University Work Support Center, led by Dr. Paul Wayman, and including staff of Dr. Catherine Inge, Valerie Brooke, Grant Revel, Dr. Mike West, and Dr. Carolyn Graham. CEDL staff that are working with me on the KTER Center are Dr. Kathleen Murphy, Research Director, Joanne Starks, Program Associate, Stephen Boydston, Research Assistant, Ann Williams, Program Specialist, John Middleton, Web Administrator, and Tracy Bauman, Administrative Assistant. I would also like to take this opportunity to especially recognize our great KTER Center Project Officer, Dr. Pimjai Sedzawud. Thank you, PIMJI, for your ongoing support and guidance. Okay, so saying that's my brief introduction. As of this morning, we weren't sure that Mr. Tschida, Director of NIDRR, had made it on the line yet. So, Mr. Tschida, are you there?
I am. Thank you very much.
Welcome, welcome. We are very pleased to have the Director of the National Institute on Disability and Rehabilitation Research, often referred to as NIDRR, with us today. The KTER Center is supported by NIDRR, and we're pleased that Mr. Tschida is here to give us his comments. He joined NIDRR as director in March of this year, and prior to that served as Vice President for Public Affairs and Research at the Courage Kinney Rehabilitation Institute in Minneapolis. With that, I'll turn it over to you, Mr. Tschida, and again, we are very happy to have you with us.
Well, thank you very much for the invitation and the opportunity to make some brief remarks on behalf of NIDRR. I want to thank all of you for the important work that you do. I hope you get a sense from my comments this afternoon of where we are today at NIDRR, where we are going, certainly in the context of the recently passed Workforce Investment and Opportunity Act, but in both of those scenarios, I hope you take away our strong historic commitment to the work that you all are doing in the knowledge translation space, and we will carry that commitment forward with us to our new home at the Department of Health and Human Services with the Administration on Community Living. So we are in the throes of our year-end flurry of activity here at NIDRR, trying to wrap up a number of competitions and grant awards before the end of the fiscal year. We are also deep in the throes of mapping our future as a result of the Workforce Investment and Opportunity Act that will move us to our new home at the Department of Health and Human Services. And some of the folks internally here have referred to it as rewiring the house while the lights are still on. Really living in two worlds, the world of systems and processes and regulations within the Department of Education, while also preparing for our future in a very different world at HHS, but one that I think presents us with a tremendous amount of opportunity. So change like this, and big change, often is anxiety producing, not just for our staff, but for our multiple stakeholders as well, and those include our grantees and those interested in the field, such as yourself. As you're aware, and as I indicated in my letter to our stakeholders in August, late August of this year, we are doing everything in our power to continue business as usual during this period of transition and period of uncertainty. We are hoping, and it is certainly one of our major goals, to make this as seamless and as painless as possible for our grantees. We are operating under a delegation of authority that is now in effect from the administrator at the Community Living Administration within HHS to continue to do everything that we are doing today while we are preparing for our future. A couple of things that you may know about that are in process that have not yet been completed that I want to assure you are continuing to move forward, and that is the addition of our Rehabilitation Research Advisory Council that we see as a critical sounding board and link to the field that actually began here in conversation at NIDRR, something we've been planning for almost 2 years, and as a result of the new law has slowed us down a little bit, but we remain committed to moving that advisory committee forward and really using that to build a culture of research within the administration on community living. As many of you know, this group at HHS has a strong evaluation component, but they have no research authority and really no culture of research within the organization. That's something that we are looking to build and have already had productive and positive conversations with our new colleagues at ACL about, but are also looking for the expertise and advice from leaders in the field to assist us in that process. Some things in this transition are going to move quickly, other things are going to take some time. I think as an easy example of some of the things that we are able to move quickly on as a result of the new law that gives us authority here in the peer review process to use federal employees as peer reviewers, and we have already begun to institute that practice after the advice of our general counsel and agreement with general counsel at HHS. Other things are certainly going to take time, and we have a number of subcommittees that are currently working on everything from looking at our information technology systems to our grant processes and our regulations, as well as our human resource practices in transitioning from education employees to HHS employees for all of our staff. I think it's fair to say we have scoped the size and quantity of the issues that need to be addressed. We're currently in the prioritization process and establishing a timeline for the implementation of this transition, some of which we are hoping to accomplish before the end of this calendar year. Many of the other elements of this transition will take up to a year and even beyond, but I can promise you that we will be as communicative and transparent as possible in this process. Once we have our timeline established, we are already talking about having a number of stakeholder calls that I and Administrator Kathy Greeley from the Administration on Community Living will conduct jointly, and there will be a question and answer component to those calls so that we can receive feedback and comments from the field as well. So if I haven't been explicit in saying so already, our conversations to date with ACL and the senior leadership there as well as the career staff has been very positive. They have been very welcoming and in a lot of cases deferential to what it is that we are doing at NIDRR. They are looking to understand not just what we do, but why we do it and how we do it, and are being very respectful of our historic priorities, and even in the finalization of our fiscal year 15 spending plan are being very inquisitive but also deferential to the priorities that we have established. I think, as I said, establishing a culture of research within and in partnership with our ACL colleagues is going to be critically important, and we are well on that road today. A part of the discussion that we are having with them is that research, as I said, distinct from evaluation, often involves investments over time and requires patience, both to build the evidence base and to get to a point where we need the knowledge translation functions that you all are here to talk about today. And while I can't comment on the specifics of that FY15 spending plan, I can tell you that we are very interested, especially in an employment context, in understanding and continuing to understand what is happening in the more than 70 current employment research and development projects that NIDRR has funded. We remain committed to an increased understanding of the processes and practices that will lead to successful knowledge translation in an employment context. We remain interested in increasing the adoption and use of relevant research findings funded by us at NIDRR and also other entities to improve employment outcomes for individuals with disabilities. And we remain committed to increasing the capacity of our NIDRR-funded, specially employment-focused grantees to both plan and engage in knowledge translation activities. So, while I can't speak to the specifics of the priorities that will be established in fiscal year 15, I think you will see that they have been consistent with our historic investments in this area and our continued desire to stress the importance of knowledge translation as we move forward to our new home within the administration on community living. We also, as you know, have established and developed very strong partnerships with our colleagues at RSA, especially in the vocational rehabilitation area, where we have shared joint project responsibilities and look to our grantees to interact with policymakers here at the Department of Education to understand emerging practices, promising practices, and to continue down the road toward evidence-based practices in the area of employment for individuals with disabilities. And we fully expect that this partnership and these relationships will continue, again, with our new home at HHS. So I know that you have some prepared comments from U.S. Senator Tom Harkin. In closing, I just want to thank Senator Harkin for his more than 30-year commitment in the U.S. Senate to the population of individuals with disabilities. The Workforce Investment and Opportunity Act would not have happened without the direct influence and tenacity of Senator Harkin, so I want to thank him personally for that, and hope that I've provided you with some new information as well as some comfort that knowledge translation remains, and I hope will remain, an integral component of what NIDRR does, or I should say now the National Institute on Disability Independent Living and Rehabilitation Research will continue long into the future. So I thank you again for the invitation and the opportunity, and wish you luck over the next day and a half as you continue your conference activities.
Thank you so very much. Joanne, I'll turn it over to you.
Thank you, John. We definitely want to extend a big thank you to John Tschida for coming this afternoon and sharing his thoughts about the transition period. I also want to thank you, John Westbrook, Director of the KTER Center, for getting things started this afternoon. Now we'll move on to, you see our picture here of Senator Tom Harkin. He has represented the state of Iowa for 40 years, serving as congressman from 1975 to 1985 and as senator for the past 30 years. During his years as an elected official, Senator Harkin has been a champion for people with disabilities, with his signature legislative achievement being the Americans with Disabilities Act. He has served on the Health, Education, Labor, and Pensions, or HELP Committee since his election to the Senate, and he succeeded Senator Ted Kennedy as chair in 2009. In 1991, Senator Harkin was the first recipient of the Distinguished Service Award, the highest recognition conferred by NARTEC, an association of NIDRR-funded projects. Senator Harkin also served as chair of the Senate Committee on Agriculture, Nutrition, and Forestry, and as member of the Small Business and Entrepreneurship and Appropriations Committees. Senator Harkin and Ruth, his wife of 36 years, still live in the house where he was born in Cumming, Iowa. Senator Harkin will be retiring on January 3, 2015, at the close of the 113th Congress. We are very pleased that he has taken some time to share his thoughts with us by video on how research impacts policymaking.
Hi, I'm Senator Tom Harkin, and I appreciate the opportunity to share my thoughts with you today by this video. Let me first extend greetings to a number of people. First, Dr. John Tschida, the Director of National Institute on Disability, Independent Living, Research, and Rehabilitation, which is moving to its new home, by the way, in the Administration on Community Living in the Department of Health and Human Services. Also, Pim J. Sudsawad, the Knowledge Translation Program Coordinator, Janet Lebrecht, the Commissioner of the Rehabilitative Services Administration in the Department of Education. As many of you know, Congress recently passed the Workforce Investment and Opportunity Act, which I'd worked on for 5 years as chairman, and we passed it with overwhelming bipartisan support. The vote in the Senate was 95-3, and in the House the vote was 415-6. President Obama signed the bill into law in July. Embedded within this new law is a set of amendments to the Rehabilitation Act that will greatly improve opportunities for people with disabilities to obtain and retain employment in competitive, integrated settings. Many of those amendments focus on young people with disabilities. The aim is to help them get the experience, develop the skills, and obtain the supports they need in competitive, integrated work settings as they transition from school to work. As you know very well, the workforce participation rate of people with disabilities is shamefully low. For some group of people with disabilities, such as those with intellectual disabilities, workforce participation rates hover in the mid-teens. Now, this is completely unacceptable. So we must look to practices to address this problem. Now, as a group that focuses on evidence-based knowledge and putting that knowledge into practice, you will see that we closely examine the evidence about what works to increase employment. One of the lessons we took from the research literature is that experience and practice in real settings is critically important. So one of the new requirements in this law is that young people with disabilities must receive pre-employment transition services that include practice in soft skills development, opportunities for internships, and job coaches to help them navigate through the world of work. We also recognized that it was important to address not only the skills, knowledge, and experience of potential employees, but also to determine the needs of retailers, manufacturers, and other businesses in order to match potential employees to employers. So we charged the Department of Labor with directly addressing the persistent problem of low workforce participation of people with intellectual and developmental disabilities in competitive integrated employment. Finally, you will note that in many places in this bill, we require the departments to focus on increasing the supports and services that enable people with disabilities to live independent lives. Independent living, as you know, is one of the 4 core goals of the Americans with Disabilities Act, and it's important that your work is focused on making that goal a reality. The next step in addressing the employment challenges for people with disabilities is by ensuring that regulations developed around the new amendments for the Rehabilitation Act are grounded in evidence-based research. I urge all of you, through your work with the Knowledge Translation for Employment Research, and also with NIDRR and RSA grantees, to share your experience with the Departments of Labor, Education, and Health and Human Services as they draft these regulations. High-quality research can help inform how we increase employment for people with disabilities. That makes the work of NIDRR and KTER Center vitally important. So thank you for continuing this important work. Thank you for all you are doing to make the goals of the ADA a reality for all Americans. So I wish you a successful conference and by all means a safe trip home afterward.
Those were really some inspiring words from Senator Harkin. We really do appreciate that he found some time to share his thoughts about research and the changes coming through the Workforce Innovation and Opportunity Act. You heard him say it, NIDRR, a couple of times, so we know those changes are coming. And also, as the Senator pointed out, be sure you are all very careful going home tonight. We want everyone back with us again tomorrow. So, following our welcome from the Director of NIDRR, or NIDRR, and from Senator Harkin, we are ready to start our session focusing on employment research related to the policymaker audience and how to translate research in order to have an impact on policymaking. We will begin with a brief report on the KTER Center's research, which will be presented by Dr. Kathleen Murphy and Stephen Boydston. They will discuss the guiding questions at that time. Next will be a presentation from Katya Albanese and Hope Adler of ePolicyWorks, a project supported through the Office of Disability Employment Policy in the Department of Justice. After a 10-minute break, we will have a panel discussion responding to the two presentations. Kathleen Murphy will close out the session with a brief takeaway message. So let's get started, and I will hand the virtual microphone to Kathleen Murphy and Stephen Boydston.
Good afternoon and good morning. We know we have a national conference here and there's different time zones going on. As Joanne mentioned, I'm Kathleen Murphy here. I'm the KTER Center's Research Director, and I'm here with Stephen Boydston, who is a research assistant at the KTER Center. The formal title of our presentation is Use of a Champion as a KT Strategy with a Policymaker Audience. So I wanted to start first with giving the overview of the research goals of the KTER Center and the research trajectory into which this study fits. Then I'll talk about the research design and methods, and Stephen will take over and talk about some of the results from our research with policymakers and policymaking organizations. As I outlined in the priority to which we responded, the NIDRR priority, our research goals were to identify evidence from the literature in selected specific employment topic areas for persons with disabilities. Then we were to describe factors that impede or facilitate the use of employment research, and finally test the effectiveness of KT strategies that promote research use. So this is a tiered set of activities. Clearly, if you're going to be doing a KT strategy, you need to be discussing something that's evidence-based, so that needed to be identified first. Then, consistent with some of the work done on the theoretical domains framework, if you're going to select a KT strategy, well, you need to figure out what are the barriers there, what might get in your way of having your message get good uptake from your target audience. So that's the second part. And then once you've got your message and your way to get it out, then you test it. So in order to figure out what the evidence is, we were tasked to conduct systematic reviews and research syntheses. And the barriers and facilitators work, we did concurrent investigation of different kinds of barriers in the four audiences that John Westbrook outlined earlier: the VR professionals, people with disabilities, policymakers, and employers or members of the business community. And then figuring out what are the best strategies to promote the use of the evidence. So I think that should be clear by now. Now what we actually did was a couple of systematic reviews. Both are in the peer review stage, and we expect that they will be published in the coming fall or perhaps spring in the Campbell Collaboration Library. One was led by our partners at Virginia Commonwealth University, and it was about return to work for adults with traumatic brain injury. And the second systematic review focused on employment for cancer survivors and what kinds of interventions work to promote their employment outcomes. We selected the barriers and facilitators study methods to ways that we thought best fit the audience. So since among these four audiences, VR professionals are the only ones that you can really bound as a research population, we conducted an online survey that was geographically diverse, including 6 states from the Northeast, East, South, Southwest, and the West. For policymakers, we thought that they needed more a sense of confidentiality, and we wanted to really get more in-depth about decision-making processes, so we conducted one-on-one interviews over the phone with 25 of them. And with business people and people with disabilities, we conducted 19 focus groups. One thing the priority did not define was what a policymaker was. So we used those interviews with the 25 policymakers, and we had to start with some kind of definition. So we used, as a beginning point, the committee staff at congressional level. And our partners at Virginia Commonwealth University also had great connections with people in VR state agencies, so we talked to people who had affiliations with those agencies. And then we asked them, what did they think about what appropriate definition of policymaker would be. And the other goal of the interviews, as I mentioned, was to figure out, well, what are the barriers, what are the facilitators, what would be a good KT strategy to test. Our interviewees had different things to say about what a policymaker is. They said, well, a policymaker writes legislation, a policymaker votes on the adoption of policy. As mentioned, or as John Tschida alluded to, there's a lot, obviously, of regulations that can go on that affect research, that affect policy. So a policymaker might be involved in writing, publishing, issuing, or promulgating policy regulations or guidelines. You know, you can think about policy not just in governmental contexts, but in institutional ones. And policymakers, perhaps more like when you think about medical research, develop handbooks, develop instructions to the field, set guidelines for procedures that then end up in, say, health insurance policy. So we were pretty broad in the way we thought about policymaking because we thought that was suited to our diverse audiences as well. People also pointed out that policymaking happens at the staff level, and that advocates can be part of the policymaking process. And this is a quote from one of the interviews we did with someone who was a high-level agency official at the federal level. And she said, I just don't think of the policymaker as being the person at the top of the diagram. So we really, you know, are thinking about decision-making processes with the agent being corporate, not individual. We also looked at the literature, obviously. Oliver and colleagues at the University of Manchester did a very timely, for us, systematic review on barriers and facilitators to the use of evidence by policymakers. And what I want to draw your attention to is the top 5 facilitators of evidence use. And you'll see that in those top 5 factors I put in italics, something to do with relationships comes up, whether it be collaboration, relationship with the policymaker, relationship with the researchers, or the information staff. So we thought, okay, well, this is coming up in our interviews as well, that really these are networks that are going about as the agent of policymaking. Let's do something that focuses, therefore, on relationships to test our strategy. We also found in our interviews, though, unlike here, I'll just go back, in the systematic review, the barriers, none of those really have to do with relationships. But in our interviews, people pointed out that your network can act as a barrier, because if you are tightly associated with a particular constituency and your target policymaker, person, or entity is not a part of that network, then you may be perhaps, you know, looked a bit askance. And I must admit, many, many years ago, I worked for the elder Senator Chafee, and one of the first things he would always say when we would come in with some idea is, or, you know, talk about a piece of legislation, the question was always, well, who's sponsoring it? So we had to really operationalize this idea of relationships. And one thing that is prominent in the KT literature is the notion of a knowledge broker. And there are different things that, or kind of domains of activity that a knowledge broker can get involved in. One of them is being really more the person who kind of handles your KT for you. So really, you know, managing the function. Another thing a KT broker might do is build capacity and train researchers how better to get their own research out and promote its uptake. And a third way, and this is really where our sense of the champion focused, was the KT broker acts as a linkage agent. So focusing on the interface between the creators and users of knowledge, and seeks to foster links between the two. So the research question we developed was, does the use of a champion in requesting policymakers' endorsement of the webinar increase the number of endorsements the statement receives? So one might ask, what webinar? What we did was link together our three activities. We developed a webinar that was designed to inform our employer audience about our cancer and workplace accommodations issues, working with a trainer from the Equal Opportunity Employment Commission. And it included the research findings that we identified in KTER systematic review and some of the policy content that we developed in collaboration with the Southwest Americans with Disabilities Act Center, one of CEDL's other research partners on other projects. Excuse me. So using a champion, an individual the organization is likely to know or trust, this linkage agent, we designed a two-part campaign. We had an introductory letter from CEDL with request for their signature on a letter to be sent to the employers endorsing the webinar. And then we would follow up with a phone call and then at least 2 reminder emails. So everybody got that packet, a hard copy, and then followed up with digital and more interactive communication. The intervention group got an additional cover letter signed by a champion pointing out the aspects of the champion's background that's compatible with the recipient organization's mission. So we had a convenient sample of 30, and we randomized 15 of them getting some kind of letter, the cover letter from someone they knew, and 15 with no champion. So now I'm going to turn it over to Stephen, who's going to discuss what happened.
Thank you, Kathleen. My name is Stephen Boydson. I'm the research assistant here at the KTER Center, and we're going to start by looking at some of our outcome measurements for this study. So first, we're going to look at the number of endorsements for our intervention versus comparison groups. We also looked at the number of follow-up interviews we were able to receive, which was an N of 9, asking about the reasons why they may or may not have decided to endorse this letter that we sent. So first part of our results, we'll be looking at the champion group. We had 9 of those individuals or organizations who chose not to endorse versus 6 who chose to endorse, whereas our no champion group had 5 who endorsed and 10 who did not endorse. However, you can see in this next graph that the endorsements varied much more widely by the type of organization that we were requesting the endorsement from. There was very similar numbers for our cancer and disability organizations, whereas the business community, we had 0 who are actually endorsing our webinar and 6 who did not, obviously. However, some of the organizations that chose not to endorse did act through proxy actions. And by proxy actions, we're referring to mostly things that they may have done to actually promote the webinar, although it wasn't official. So we actually had 2 in the champion group and 1 in the non-champion group that said that they wouldn't endorse, but offered support in other ways. So some of these ways included promoting the webinar on their website for no cost, agreeing to have the content shared or used the content that we used in the webinar, or they may have sent the registration to their email list and other constituents, or posted registration information on their social media sites, Twitter, Facebook, and LinkedIn, and so on. Some of the barriers to endorsement that we found through our interviews and speaking with these people was that, first of all, we may have had no response at all from the organizations in attempting to contact them. Out of the 4 that we were not able to contact at all, 2 of these were from our champion group and 3 of these were from our no champion group, and 3 of the 4 were actually from the business-oriented organizations. Second thing that we found as a barrier is many of the organizations wanted to be involved in the product development early on in the process so that they would be more aware of how it was done and the work that went into it. Another organization may have had a formal policy prohibiting the endorsement, whether it was from their board or their funder. They may have had an official policy saying you're not allowed to endorse someone else's materials. There could have been no policy in place for the organization to handle these requests. This may have also been involved with the timing. If a specific staff member had left the organization or if there was a change in leadership, it may have been an inappropriate time to approach them. Or perhaps the recipient of our invitation was part of a network and was unable to speak for all of the individuals of that network. Next, we'll look at some of the facilitators to endorsement and what helped us obtain some of the endorsements that we were looking for. First, if the webinar materials were consistent with the organization's mission, they were much more likely to endorse. The recipient, if they were familiar with the KTER Center or its principal investigator, that helps our cause as well. Knowing other endorsers helps confirm their decision to endorse. Or if the recipient had a personal connection to cancer or the topical material of the webinar, they're again more likely to endorse. A few things that didn't seem to make a difference that we were looking at is the sending of a hard copy letter. Having signed those and sent them out, we thought that they may actually influence people. However, didn't see much of a difference between those groups. Whether or not the webinar was evidence-based did not seem to make a difference for our group as well. And the trainer, Joe Bonke, when people knew him, they were favorable to it, but did not seem to actually impact their decision-making process on the endorsement. And now we're going to go back to Kathleen for a few final thoughts.
Okay, so I'm looking at Susan Pasterno has a question here. Did they share their research with the Job Accommodation Network? So to give you a little more information about the sampling, I said it was a convenient sample, which it was, but we had a larger list, and we compiled that list by looking at entities, first of all, that had published something on cancer and employment. So that ended up being a variety of disability-oriented and cancer-oriented organizations. And then we also included business-oriented organizations that participate in policy discourse about disability and employment, sometimes not in an advocacy role. Sometimes they have concerns, perhaps, about compliance issues or regulatory issues, but they are certainly stakeholders and participate in the discussion. So we sampled 30 from that list of, I think there are about 51 organizations. We did promise our participants anonymity, so Susan, I hope that gives you enough of the flavor of who we engaged with, but I can't actually directly answer your question as to whether or not we approached the Job Accommodation Network. Those who did endorse the webinar, they are on the KTER website when you look at the information about webcasts, so those people chose to make themselves public, and those are obviously our endorsers. So anyway, thinking back to this sampling strategy, it ended up that we got more endorsements from disability and cancer-related organizations than business-oriented ones. So that seemed to be more of a determining factor than whether or not there was this cover letter from the champion versus non-champion, which frankly, a lot of people ignored the hard copy, as Stephen mentioned. So some people may not have even really noticed that letter. And this relevance of domain to cancer and disability is obviously related to the KTER Center and CEDL, and the KTER Center's principal investigator, John Westbrook, our own positioning within the network of organizations to which we were conducting outreach through our other projects at CEDL that relate to cancer and disability. We have prior ties, and some people I think recognized my name because I signed the cover letter that all 30 of them got. So strengthening some ties may mean weakening others. Relationships can be a barrier or a facilitator, and in going forward, if you're thinking, well, you know, I have some findings, I want to maybe use this champion idea to try to approach an organization with whom I'd like to strengthen ties, obviously you need to think strategically about who your alliances are and what the consequences are and the implications of aligning yourself with someone in a political landscape. As one of our interviewees in the Policymaker interview set, and this was with someone who was not ever a policymaker himself, but had been on committee staff and was instrumental in several major pieces of disability legislation in the past 30 years. So he warned me, there's a plus and a minus to being with a spokesperson, because that person and that organization comes with baggage as well. Our next presentation is scheduled to go on at noon, and we are absolutely thrilled to be welcoming Katya Albanese and Hope Adler of ePolicyWorks with their presentation, Policymaking 2.0, Using New Technologies to Inform Disability Employment Policy. So I'm going to tell you a little bit about Katya Albanese and Hope Adler. Katya Albanese has worked for 12 years on projects related to disability employment, veteran affairs, and emerging and accessible technologies. Currently, she directs several public education and outreach campaigns and policy initiatives for Concepts Incorporated. She leads their ePolicyWorks initiative, which is funded by the U.S. Department of Labor's Office of Disability Employment Policy, commonly known as ODEP. Hope Adler has more than 13 years of experience working on government affairs and strategic marketing. Her current work with ePolicyWorks focuses on facilitating the exchange of best practices and policies on disability employment issues. Hope manages campaigns to increase awareness of ePolicyWorks initiatives among its stakeholders, and they include federal agencies and non-governmental organizations, disability-related advocacy groups, employment service providers, employers, public policy organizations, and congressional offices. So if there's something to say about policy, ePolicyWorks can say it, and we welcome them.
Thank you so much. This is Katya Albanese, and I'm here with Hope Adler, and we are very excited to be part of your presentation today. And thank you so much for joining us and listening to what we have to share about our efforts at the U.S. Department of Labor's Office of Disability Employment Policy. So just quickly on your screen is our presentation outline for today and what we're going to cover in the next 20 minutes. We're going to tell you a little bit more about what ePolicyWorks is and how we are changing the way the government does business through the eyes of the policymaker at the U.S. Department of Labor, and how we are adopting new technologies through ePolicyWorks to help inform the policymaking process and to really arm our policymakers with the tools to help them do their job in more efficient and effective ways. And we'll give you a few examples of what some of those online tools are that we are using at DOL, and some examples from the field that we think will really resonate with you as our participants. And of course, to share with you some of the lessons that we've learned as we engage with these new tools and try new ones and other outreach and communications efforts. And we're always trying to learn new things and share what we learn with our colleagues as well. So what is ePolicyWorks? We mentioned Hope and I both work on the ePolicyWorks team, which is funded by the U.S. Department of Labor's Office of Disability Employment Policy, and it's truly a collaborative approach to federal policy making. We use web-based technology to increase stakeholder involvement and engagement, and real-time information sharing, again, in order to modernize the way that the federal government is doing business and informing the policymaking process. This really, ePolicyWorks is a way for us to investigate promising practices as well as online tools to, again, aid our policymaker with the ability to engage a larger stakeholder audience, to collect information and research, and again, inform their policymaking process. And in doing so, we've really changed the model for policy building and established a new model, a recognized and award-winning, we're proud to say, model for that. And one of the major points of ePolicyWorks is to support the administration's movement towards an open, participatory, and transparent government. And we will talk a little bit more about that in a few minutes. And what, again, as part of this effort, we really have been trying to integrate as much as possible those online tools, productivity, crowdsourcing, web-based tools that can really support the policy-making efforts and help improve them. And Hope is going to talk a little bit later on about specifics regarding those tools. So what do we mean by changing the way the government does business? As I just mentioned, this current administration has a very strong push towards more of an open, transparent, and participatory government. That means that we are using social media tools, we are using other forums to really engage not just policymakers and key stakeholders, but the public at large. And so, we are not just exporting information or pushing information out, but trying to collect information and share, really have a collaborative dialogue with our stakeholders in order to collect really valuable information that can inform the policy-making process. And so, and taking that information really allows us to see what's happening on the ground, to really understand how rules, regulations, other policies, guidelines are affecting the public or the constituents for which they are created, and then taking that information and improving that policy, but in a faster, more efficient, and effective way. And as you may have gathered from the Office of Disability Employment Policy, our constituents are the disability community as well as the greater employer and business community. Kathleen and Stephen were talking about engaging policymakers in their presentation, and it's very, very important that in order to inform the policymaking process that we are actually getting the information from the audience that we are trying to develop the policy for, really informed policy-making activities. And there is a term that our colleague at the Department of Transportation coined many years ago that we commonly used, and it's called BORPSAT, and that just simply means a bunch of the right people sitting around the table. So although the tools allow us, the use of online tools allow us to reach greater audiences, we still need to make sure that we are getting a bunch of the right people sitting around the table. And now, with this online engagement, we are expanding BORSAP to BORPSAPT, which is a bunch of the right people sitting around the virtual table. And that just means we have a larger table, we're less reliant on logistics, it is more accessible, and that is double meaning, more accessible in that we're talking about individuals with disabilities being able to access the tool, that it is accessible to them, as well as access as in broadband and being able to get online. And that is easier for people to do than to, in many cases, get to one physical location, which makes it much less expensive and, of course, increases availability, meaning just as we are today, it's easier to log into an event or check out an archived event at your leisure. And so one additional thing I'd like to add about what makes ePolicyWorks a little bit different as far as modernizing how we are doing business in the federal government with the Office of Disability Employment Policy is that it's not just open, transparent, and participatory, but it's also inclusive. It's very important to us that the tools we are using are usable by everyone, by the largest amount of people, which includes individuals with disabilities. So through the work that we do, we do try many new different tools that have accessibility issues, and we work with the vendors to try to address those issues, and not just on a compliance level, but really on a usability level. And we try to, in our work, also encourage policymakers to demand that the products that they are starting to use, these online tools, are accessible and accessible to all. Because again, it's very important, especially for our effort, where we are directly trying to reach individuals with disabilities, that they and everyone are able to access the tools that we're using. And so with that, just to give you an idea of really how all of these tools sort of support the policy development model, ePolicyWorks, again, is it's an initiative that allows policymakers to use these different tools. And we make available for them several different types of tools. Online collaborative workspaces, which are secure online working groups, where policymakers can share documents, they can have discussions, they can post resources, but it's in a secure cloud-based environment. And then we also have our online dialogues, which Hope is going to be talking about shortly. This is using crowdsourcing tools to help us collect information and collect ideas from stakeholders that are, outside the small policymaking groups, our online policymaking groups. And that information is then synthesized and then brought into these online collaborative workspaces for the policymakers to work with. And so what you see on the screen here is an infographic that basically demonstrates how ePolicyWorks is in the center, and coming into ePolicyWorks is the information being gathered and contributed by policymakers, grantees, and other representatives, technical assistance centers, and NGOs, non-governmental organizations that are involved in the issues that the Office of Disability Employment Policy supports. And also being pulled in is information from news and regulations, data and analysis from our online dialogues, events and other meetings and information that comes from them, and reports and documents that are all kind of pulled together and collected through ePolicyWorks and through the use of these tools, so the policymakers can make really informed decisions as they develop policy in this new environment. And so in talking about adopting new technologies, there are definitely benefits and there are definitely challenges. And so the benefits, of course, overcoming organizational challenges, enhancing communication, increasing productivity through the use of these tools, saving money, and increasing inclusiveness, which means that we're able to reach more people and gather information from more people in the use of new technologies. And what are some of the challenges? There's a hesitancy to use new and unfamiliar technology. People are sometimes afraid of what they don't know. There's resisting to changing the business practices. Many people don't want to, if it's not broke, don't fix it. But what we found is that the use of the tools is actually improving the way that they do business, but there's definitely resistance. Insufficient participation from the entire group. What this means is sometimes you have a few individuals that are really willing to try the new technologies and others that are a little resistant, and some that will and some that won't. And so that inconsistency can be definitely a challenge. You want all to participate. And sometimes there's lack of leadership. As we all are very aware, if there is a charge from above, that can really influence how we work or what the business practices that we engage in. And so it's very important for us to have leadership buy-in, even with just the simple use of new technologies. And so with that, I will turn it over to Hope to talk a little bit more specifically about the tools that we're using.
Okay. Thank you, Katia. First of all, I'm going to talk about some of the tools we are using for policymakers. We call it social media, but I have a definition here so that we don't think of social media as just Facebook and Twitter. Social media is defined as forms of electronic communication, such as websites, etc., through which users create online communities to share information. It is the future of communication, a countless array of internet-based tools and platforms that increase and enhance the sharing of information. So I really wanted to stress, that's how we've really looked at it, as a way to share information, not just to distribute, but to truly collaborate. So in front of you, you see a number of tools, some that you may not have considered social media, but what we consider as part of ePolicyWorks, blogs we use, Facebook, and then podcasts, instant messaging, all these different communication tools. And finally, at the end, you'll see crowdsourcing, which is what I'm going to focus on today, and one of our most successful tools for policymakers. Okay. What is crowdsourcing? Crowdsourcing is the practice of soliciting ideas or contributions from stakeholders to solve problems and make decisions using an online tool. Some of you may have heard of it as online dialogues, virtual town halls. It's a way for policymakers or those who support policymakers to get information to collaborate with stakeholders and constituents. It provides a huge cost benefit and efficiency and serves as an outreach tool. The Department of Labor, ODEP, had been doing, what were their meetings called that they were doing?
Town halls.
They were going across the country and doing town halls and spending a lot of money in specific locations across the country. And unfortunately, that means that you get maybe 30, 40, 50, maybe even 100 people in a room. And sometimes there's accessibility issues, logistic issues, etc. The nice thing about crowdsourcing tools is it is open to everyone. And as Katia stressed in her part of the presentation, we work really hard to make sure that all the crowdsourcing tools we use are accessible. So anyone can use them from their computer, anywhere, anytime. It also serves as an outreach tool in the sense that, and I'll go over this a little bit later too, not everyone who visits the dialogue may put an idea out or make a comment, but everyone is reading the page. So we get about 20% participation of people versus visitors. But those visitors are all learning about what your agency is doing, what your organization is doing, what the project is about. So we continually stress not only as a way to get feedback from the community and get ideas from the community, but it's also a way to let them know what you're doing. Okay. Why crowdsourcing for policymakers? So really, and Mike Reardon, who we work with at ODEP, has been a big proponent of this. This is an easier, cheaper, faster way to create policy. It encourages interactivity. You have submitting, you have voting. Not only are you seeing everyone's ideas, but people are able to comment on those ideas. Maybe it's something that they didn't think of, oh, that's a great idea, or even to further elaborate. That's a great idea. We do that in our state, and this is how we implement it, or we tried that and it didn't work. It expands the reach. Policymakers all of a sudden can hear from thousands of people. It promotes transparency. We talked about open government and how important that is to this administration. And allows flexibility engagement. You can do a 2-week online dialogue, which we've done, so over a short period of time. You can go back to those same people and do a second dialogue. You could ask them to further elaborate or consider another issue. So as you do this dialogue and you gather emails and participants, this is a resource that you can go back to time and time again. And then in the end, you have both quantitative and qualitative data. We do a lot of tracking of who participates, where are they coming from. We gather information. Are they a business? Are they an NGO? So it allows us to not only gather a number of ideas and comments and votes and see what ideas are popular, but we can also see who we're reaching and who's participating. And we can adjust. If we see we're not getting enough people who represent the disability community involved in a dialogue, we can reach out to that community and ask them to participate and do targeted outreach, which has been very successful. How does crowdsourcing work? So we use IdeaScale, which is a platform that we work with because of its accessibility and ease of use. We work with whoever's interested in doing a dialogue. We help them decide, help them come up with the issue, the question that they're going to put out to their stakeholders, and then we do targeted outreach. So though it is open to everyone, we've done 10 dialogues, none have been closed. Though it is open to everyone, we do targeted outreach. So who does the policymaker want to hear from in this instance? And then we spend a lot of time trying to reach that community. Another thing about crowdsourcing is it's a self-moderated community. So we do have moderators who go in and try to help keep the conversation going, but you'll find that other people jump in and make comments, and they kind of help guide the conversation. When we first did this, there was always some concern about off-topic conversation or derogatory conversation. And I'll tell you, in our 10 dialogues, we have not had any issues around that. So we've had a very positive experience. We also have this whole registration process where people register for the dialogue, and then they submit ideas so we know who is participating. Sometimes it can be anonymous. I mean, we do collect emails. In some cases, we collect more information. Who do they represent? Are they part of what community? And in some cases, we keep it very simple. It depends on what kind of information is helpful to you. We really try not to collect any information that we don't need or aren't going to use. There's also a viral part of crowdsourcing, which we've been very successful with, where people are able to tweet and Facebook and send the link out and share it over social media. And that's been extremely successful, posting it in their newsletters, sending out via email. So it does kind of take on this viral community. And then by voting, the best ideas rise to the top. So those that get the most positive votes end up at the top of the list, and then people, they're ranked by order of voting. So in front are some examples. This is kind of what our template looks like. The one all the way on the left or the right is closed. So after a dialogue is closed and people can't participate any longer, there's still information about the dialogue, and you can still see the ideas underneath. Okay. Now, I'm going to go over two dialogues that we recently had. Well, the very first one we did was Federal Partners in Transition. This came out of a question actually out of Harkin's office about the coordination between the different agencies involved in transition services. They were the Department of Labor, Education, HHS, and Social Security. They all worked together for this dialogue, and they came up with the question, what legislative and regulatory changes need to happen to effectively implement employment, education, health, and human and social services for youth and young adults with disabilities under public law? Now, we didn't know how this would go. This was our very first dialogue, and it seemed kind of like a technical question, but each of the agencies helped us do outreach. We did a lot of outreach, and in the end, over a 2-week period, we had over 3,000 participants. And you can see the breakdown there of where they came from, a total of 355 ideas, 1,600 comments, and almost 10,000 votes. This was over 2 weeks. This was considered very successful. Of these 355 ideas, almost a little bit over 100 were considered viable by the subject matter experts. As part of the process, the subject matter experts review the ideas and pick out the ones that they think are actionable. Our second dialogue, the most recent dialogue we did, a little bit different from the federal partners, was focused on state governments and trying to get an idea of best practices. Again, in this case, we asked 2 questions. What policy programs and practices have been enacted within your state to encourage private employers to hire and retain individuals with disabilities and state employment? So this was really looking for best practices to support the employment of people with disabilities. And we targeted state human resource divisions, Department of Disability Councils, State Office of Disability, National Association of Governors, and state grantee representatives. Now for this 2-week period, we had almost 427 total registrants. We had done a dialogue to this under a different dialogue, but with this same outreach group before. So there were people who had participated in the past who participated again. So out of those 427, 351 were new registrants to our online dialogue. Again, about 18% had participated in our first dialogue. And then 20%, as I mentioned before, were active registrants, meaning they submitted ideas, they voted, they commented. And from this 2-week period, we had 37 total ideas, 133 comments, and 355 votes. 335 votes. The main thing I want you to take away from this is that just the process, this new process for policymakers, having a dialogue, looking for feedback, analyzing, getting results, data from the constituents, analyzing it, and then leading to policy action. And then finally, lessons learned. So we've done, as I said, 10 dialogues over the last 1.5 years. They've been very different. But one thing we have learned is that constituents and stakeholders, they want to participate, they want to be heard, and they do have valuable information to share. And then outreach, just being creative in finding stakeholders and asking them to be part of the process. So really knowing who you want to reach and reaching out to them. As you guys mentioned in the earlier presentation, we did a lot of reaching out to other organizations and asking them to champion it, put it on Twitter, put it on Facebook, spread the word, and we've been very successful with that. And then here, letting it go viral, not being afraid of social media, not being afraid of having people promote your dialogue over Twitter or Facebook as much as you can. And then emphasizing that this is a good way, crowdsourcing is a good way to get information out as well as collect information. So think about what you want to tell your stakeholders and your community and include that as a way to inform and educate. And then again, what we get from these dialogues, and I think we've had 10,000, emails. We collect, so when someone registers, they want to participate, they share their email, and then that's just a resource you can use in the future to go back to again and again. And then again, following up and letting them know how you use the information that they supplied. So just closing the circle.
Okay. And that's really it. If you want to connect with us, obviously Ask Us Questions will be here for the rest of today's presentation. And you can subscribe to our e-newsletters and updates at epolicyworks.org. You can check out our archived crowdsourcing events. You can take a look at some of our online collaborative workspaces if you're interested in learning more, joining, hosting any of these types of activities. You can contact us via epolicyworks.org or our Twitter handle at epolicyworks or at epolicyworks@dol.gov.
Members of our panel were chosen to bring different points of view and perspectives to the session. So I'm going to introduce everyone on the panel, but we may not go in the same order. Myrna Mandlowitz has worked for over 20 years as a consultant on special and general education issues and currently works with 7 national organizations on federal policy and legislation and brings her perspective on working directly with policymakers. Peter Blank is a university professor and chairman of the Burton Blatt Institute, or BBI, at Syracuse University. He heads up several grants funded by NIDRR, among others, so we are looking forward to his researcher perspective. Tracy Boehm is the Director of Knowledge Translation at the University of Montana Rural Institute's Research and Training Center on Disability in Rural Communities, which is also funded by NIDRR. There, she facilitates the application of research knowledge to increase participation of people with disabilities in rural communities. And we have a few questions that were used to help guide the presenters in developing their materials, and they'll be helping the panelists in formulating their responses. First, when developing new policy or reauthorizing existing policy, what kind of assistance might policymakers need in identifying relevant research evidence and in understanding its implications? Second, what strategies work for researchers to build relationships with policymakers? Third, what formats help policymakers to better understand and use research evidence? For example, research data, tables, graphics, or personal stories. Finally, are there other factors related to promoting research, such as uptake, packaging, evidence, timeliness, that are essential to developing and implementing a knowledge translation strategy? We'll begin with each panelist sharing their thoughts for a few minutes and then follow with a few questions the panelists may have for our previous speakers. We also encourage the audience to submit your questions by way of the chat box there on the left side of your screen, and we will bring those into the discussion. I think we'll start with Peter Blank. Peter, would you like to take your turn?
I'm delighted. I hope you can hear me well. And it's a pleasure to participate in this important discussion. And thank you, Joanne, and everybody at CEDL for your leadership in this area. I'll start, if I may, at a higher level with the obvious that we are in a transformative time now for both the civil and human rights of people with disabilities. We have second-generation issues associated with the ADA. We have the Communications and Video Accessibility Act coming online. We, of course, have the important WIOA, I have to get used to saying that Senator Harkin had talked about. We have the international template of the Convention on the Rights of Persons with Disabilities, and we have new international treaties. For example, the Marrakesh Treaty with regard to cross-border use of e-books. So about 25 years ago now, the ADA was passed, and interestingly, about the same time, Tim Berners-Lee, 25 years ago, was writing the first paper on the World Wide Web, which would set off the technology revolution we're talking about today in part. So there are two parts to my comments, and I have to be very brief, obviously, because I have only 7 minutes. The first will go to the research presentation, and the second to the excellent technology presentation. My initial thoughts with regard to the research presentation at a higher level are, given this very transformative and complex legislative time, it's increasingly important, and I think this was implied in the presentation, to consider multidimensional components of policy, and policymakers for that matter, as well as, of course, advocates from a cross-disability and disability-specific perspective. I think it's safe to say, when the question was asked, what is a policymaker may be a very different animal on very different dimensions: law, disability-specific issues, generic legislation, which of course all are now increasingly interrelated. They're multidimensional. And within that multidimensionality, you have policy, but of course then you have regulation, perhaps by an executive agency. You then have interpretation by the courts, which leads to subsequent feedback, amendment perhaps, conflicts with other policies and practices. And then, of course, all of this occurs in an ever-changing petri dish of America, demographics, aging population, disability advocacy, more and more kids with disabilities entering mainstream education. And so on the policy side, I thought the presentation was very interesting and important. And what I'm grappling with is how you embed that kind of analysis within the larger policy framework that's cohesive In other words, that, of course, you can't talk about the ADA employment rates without talking about now the implications of WIOA, the Workforce Investment and Opportunity Act, or Medicaid reform, or Social Security reform, and how you embed this sort of research practices in that larger context. So that's kind of general thoughts on the first presentation. Second presentation, and please let me know when I'm done with my time, because 7 minutes is not a lot, but I hope to skim the surface of some general areas. Today, as I mentioned, and as was mentioned in the PolicyWorks presentation, we live in the world of the ever-connected, multi-device, participatory social media. We have increasingly intelligent applications. We have crowdsourcing and MOOCs, which are these massive online courses where people come together in communities and figure out problems and talk about issues and so forth. The challenge will be, as was said excellently in the presentation, is how do you make this both accessible, and accessibility doesn't mean the same thing to everybody. It can be certainly accessible to one person and not to another, and importantly, usable. That is, how is it comprehensible? How is it in plain language? How can it be acted on? And you have on top of that the overlay of course, growing issues with regard to privacy, security, and what's raised its head recently quite a bit is ownership of intellectual property. Now, in the simplest sense, of course, say crowdsourcing for the government, it certainly is a good tool to engage people in multiple ways, hopefully using multiple formats in ways that are understandable and comprehensible, and it certainly goes to the basic principles of the web, which are freedom and opportunity to engage democratically in the democratic discussion. The challenge is in our mobile, cloud-based, civil rights-based, multi-device environment where government is leading the way in many ways with regard to open government and e-government, is how do you make sure it is inclusive of so many people who still are denied basic access to the web and who are denied basic usability of the web, even if they have access to the web. And needless to say, I'll put a little bit of a shameless plug in. This week, my most recent book was published by Cambridge University Press, and it's called Equality: The Struggle for Web Accessibility by People with Cognitive Disabilities, which is arguably the largest group that remains disenfranchised from web activities. How am I doing on time, by the way, now?
You have about a minute if you can wrap it up.
Okay, well, I'm just starting to clear my throat, but I'll wrap it up. I would say that there is a direct link between inclusive policy and, of course, transformative opportunities with the web. And the future, researchers will have to be increasingly sensitive to these inclusive strategies in ways that engage many people who are currently disenfranchised, people who use English as a second language, people in poverty, and of course people with disabilities, and look at these issues from a policy perspective in multidimensional ways. So that's my 2 cents in 7 minutes, and I hope it will spur some further discussion, which I'm sure it will, from our next excellent panelists.
Thank you very much, Peter. Myrna, are you back, or should we go ahead and have Tracy go next?
Actually, I'm back. Thank you. I apologize. I was in the middle of an emergency situation here.
Well, if you're ready to go, then we'll go ahead and let you go next, and then Tracy will be our last presenter.
Okay, great. I guess I'm coming at all of this from a little bit different perspective. I'm not a researcher. I'm a lobbyist here in Washington, D.C. I'm a legislative consultant, and my thoughts around the guiding questions are really much more of a practical nature, so very concrete, practical ideas. Regarding the first question about developing new policy and what kind of assistance policymakers need, I think that Kathleen stated, and it's absolutely true, that policymaking is a process like any other that involves a number of steps, and one of those I consider to be the research phase. where issues can be raised by advocates who walk in the door of a policymaker's office with their research, or more likely where issues can be raised by lawmakers for which they're seeking research. And their staff will seek out experts. They might be researchers, they might be practitioners who are working in the field of interest, or individuals with personal experiences. And the policymakers will be looking for research to support their viewpoints, to refute other theories, if you will, and to identify how a particular policy will positively impact their constituents. That might extend to the researcher providing testimony, meeting with staff and policymakers themselves, or providing written materials and resources. So some just very concrete ways to look at the process. Regarding strategies that work for researchers to build relationships with policymakers, I was very interested in the study and talking about champions and relationship building, because that's pretty much what it's all about. Whenever I do training on advocacy, the first thing I tell advocates, whether that's researchers or practitioners or parents or beneficiaries of programs, that relationships is what it's all about. I think identifying policymakers who have an interest in the research topic, or on the other side, who could be willing to make the issue their own, as well as policymakers who can influence the person you're targeting. So you might have a particular policymaker in mind, and getting to that person through their colleagues might be another avenue. And, you know, people are researchers on this call. Use your research skills to find out everything you can about that potential policymaker, and absolutely using any personal connections to get to that person, I think, is very important. You can work individually by getting to know the staff, and this is true at the local, state, or federal level. Policymakers always have personal staff, and if they are legislators, and they also work on committees where the bulk of the real heavy substantive work is done. And of course, you can work through professional organizations or through advocacy organizations. I think the real critical piece, you know, for researchers is to establish yourself as an authority. Make policymakers understand that you're a trustworthy resource that has some expertise that can really further the policymaker's agenda. And I guess, like all of us, we like to have our egos stroked, and that policymaker has, you know, a set of proposals that they want to move forward, and they're looking for whatever will help them move that agenda forward. I think it's also important to remember that in building relationships with these potential champions, it can't be a one-time only deal. Basically, I mean by that you have to nurture relationships, these kinds of relationships, just as with any kind of relationships. And I would advise people to sort of parcel out the research. You might start out with some of the basics, but, you know, maintain kind of a regular, steady stream of information to those people so that they see that you've established your credibility and that you become the go-to resource on whatever that issue is, around whatever the research is talking about. On the third question about formats that help policymakers to better understand and use research evidence, I guess I look at a lot of this from the lens of Congress, because that's where I work the most, and most of the work in Congress, as in state legislatures or even at the local level, is done by staff members who receive tons of information from many sources. And those staff members can range from 20-somethings who've just graduated from college, who have very little, if any, substantive knowledge, to people who are PhDs, who are working on staff, who are really the substance people. So I guess my recommendation always is that summaries and clearly understood language, both narrative and data, are really important. I think staff that are, you know, the substance people are very interested in larger reports from which they can draw, but they want to know right up front what the bottom line is. Data points, very, very critical, that can nicely be incorporated into speeches or that can be used for quick talking points for a legislator. And some of the level of detail, of course, as I said, will depend on the level of knowledge of the staff person that you're talking to. Personal stories that the policymaker can relate to. I think with policymakers, it's all about how the issue that they're talking about has an impact on their constituents, and any personal information. I work in the disability field, and I can tell you that we rely very heavily on those stories that really get across how the implementation of policies really changes lives, and I still think that is very, very powerful. Research for research's sake, not helpful. You need to really know how the research is going to move the legislative agenda forward. And I guess I would wrap up. I see my time is beginning to ebb here. If there are other factors related to promoting research that are essential to developing and implementing the knowledge translation strategy. Again, I would just reiterate that policymakers really want to know about research that can be implemented and that can positively affect constituents. So I will wind up there, and hopefully there will be other questions I can respond to. Thanks so much.
Thank you very much, Myrna. Okay, now we'll turn to Tracy. And Tracy, you'll still have 7 minutes, so we will go till the top of the hour. Ready to take it away.
Okay, great. Thank you. Well, good afternoon. Thanks. It's a pleasure to be here, and I'm happy to provide some responses based on our rural perspective, being from the RTC Rural. When I was first asked to share thoughts on the use of research results to impact policymakers, I paused because it's such a behemoth topic. I decided then that the question perhaps we need to be prepared to answer when working in policy is it worth it? So is it worth it? This is something I think each of us asks ourselves rather frequently. We weigh the pros and cons of how our decisions not only affect us but also others. And policymakers who are tasked with maintaining systems and responding to potential change are really asking the same question. Their answer, however, is much more difficult to conclude as they respond to a very diverse group of stakeholders and constituencies with divergent values. So to decide if policy action is worth it, we can really look at evidence, relevance, and value. First, to cite Steve Kay, who is the Director of Community Living Policy Center at the University of California, San Francisco, a lack of any type of evidence in policy work provides an excuse for non-adoption. So we of course need to provide evidence to empirically define a problem or offer a solution. However, as Kathleen and Steve noted in their research, whether or not the webinar was evidence-based didn't matter for endorsement. So what does matter? Well, then relevance is also important. Determining relevance is addressing the scale of the issue, how many people are affected, as well as how many people are already involved in addressing the issue and why. The why, however, is perhaps better linked to the topic of values. Policymakers represent broad constituencies, many of which have differing values, obviously, and place different levels of importance on evidence and relevance. And we need evidence as part of the empirical judgments in policy review. But review also involves normative judgments. So how do we respond to the divergent values that policymakers must answer to? Some of this has been discussed already. I think Peter said, there are different interests. Advocates are mission-driven. Politicians care about preventing fraud and abuse of tax dollars. Attorneys care about laws and regulation. And researchers care about finding and creating solutions that work. We can use research information to enlighten officials to help set an agenda, and we can use it instrumentally to suggest policy actions. Some researchers may be fortunate enough to have direct relationships with policymakers, but another way of getting research information to policymakers is to leverage existing stakeholder networks that are already well connected at the policy level and that share or have similar values. Research and the names attached to it get recognized by policymakers when opinion leaders in these networks present and promote research on a consistent basis, adding to its relevancy. In true integrated knowledge translation approaches, the stakeholders are engaged early in the research process to advise and help form the research agenda. So they identify the issues to address as well as help develop the products resulting from the research. The result is a product that is designed for the people, by the people. And it is more certain to be contextually relevant, valued, and also trusted. And what is more, I think early stakeholder involvement can assist in the dissemination of outcomes and products that, when the opportunity arises, can get on the policy agenda. So timeliness is often the real deciding factor in the uptake of evidence-based research. When researchers connect and work with stakeholders in different networks, it creates a conduit to learn and exchange information. Also evaluate the evidence, identify priorities and relevancy for policymaking, and to understand the environmental context, that including people, places, and politics from the federal all the way through to service provider and consumer level. It really provides a mechanism to understand the values that exist within a context, in our context is rural, that drive the support or lack of support for policy change or adoption. So stakeholders most often have their finger on the pulse of what is relevant and timely, and they can identify what reinforces the policy agenda and what can stall it. I think it's equally important to identify then not only the consequences for not adopting a policy, but the unintended consequences from adopting. So policymakers must manage uncertainty and how to manage potential change and its impact on other people and systems on a bigger scale. I also think that what was stated before, the importance of being at the table, I also would add that it's important to be part of the conversation. Having multiple opinion leaders and networks, for example, who are connected to policymakers increases the repetitiveness and redundancy of the information shared, which is what policymakers need. Doing so ensures the topic or issue is always part of the conversation, and it prevents it from getting lost in the pile. At our center, we have a long history with some of our stakeholders and partners to maintain these connections, such as the Association of Programs for Rural Independent Living, CSAVR, Centers for Independent Living, Voc Rehab, state disability and health programs, and the consumers involved in our research and knowledge translation activities. April specifically has been essential for understanding the complexities and uniquenesses of rural communities and people with disabilities who live there. And we attend their conference every year, we share research information, collect input, create new connections, and engage with others who value rural, and who can identify the relevancy of the role of research in solving rural issues and why it matters. To conclude, involving stakeholder networks as early in the research process as possible is beneficial for procuring outcomes, solutions, and strategies for impacting policy. And when you involve stakeholders in your work who are already connected at the policy level, or at the very least with the issues and priorities, it strengthens the evidence of value and worth in research. And my time is up.
Well, thank you very much, Tracy. I want to thank all of our panelists for giving your thoughts. And I'd like to take a few minutes now and see if we can have some question and answers going. So I'd like for each of the panelists to identify a question for either one of the speakers or one of the other panelists. Peter, since you were first, do you have a question for one of the other presenters today?
Well, it's a general question, and maybe it goes to Myrna, but in this context, how do you balance competing legislative proposals which sometimes create conflicts or disincentives, as typically is taught about in the disability area, for example, in the area of employment? How do you manage that as opposed to just being too laser focused on one particular piece of policy?
Oh, that's a really good question. Well, I think, I guess what happens is you really have to establish what your priorities are and go from there. I mean, if you're talking about competing interests, are you talking about competing interests that policymakers might have? I'm not sure I really completely understand your...
The senator, of course, rightfully so, talked about the dismal employment rate of persons with disabilities, and we know that that's not a function of that the ADA was not potent enough. It's a function of, in part, also the disincentives to go to work in the system, the lack of education and training. So from your perspective as a lobbyist, how do you stay focused on what your core principles are, which may sometimes need to cross multiple policy objectives?
Well, I think, one of the things that you have to understand from from whenever you're dealing with the policy arena is that compromises are going to have to be made. And I think, again, you have your list of priorities, and it's just like any negotiation that you sort of have to know where you're willing to give. I think part of the real issue that we deal with here is laws are made, for example, the ADA, and then the implementation phase comes into being, and there has to be some clear distinction in the mind of an advocate or a lobbyist or a policymaker. Is the problem with the law itself, or is it the problem with the way it's being implemented? So I try and keep focused on the policy principles, understanding that sometimes I'm going to have to give a little to get a little. Does that help?
Yes, and my only follow-up point, then I'll be quiet, is it suggests then from a research point of view then that any policy has to be considered in context in this give and take environment, and while focused research is important, it might not be as valid when taken in the particular context that we're looking at.
Yeah, I would agree with that completely, Peter.
Well, thank you very much. Myrna, do you have a question that you would like to ask either one of our previous speakers or another panelist?
Well, I guess I would just, just the whole issue around champions and how I'm very new to the whole knowledge translation idea, and how you would explain to a champion, that you want them to focus on both the research and how that translation occurs. I'm trying to clarify in my mind the role of the champion in relation to research.
Kathleen, can you respond to that?
If the question makes sense, Kathleen.
Sure, yeah, definitely. I think that Tracy's comments speak a little bit to that, where ideally, and this is a hallmark of KT, that champion would be involved from the get-go in your research project, so that there would be an educated process that goes on between the champion, who is helping to be your liaison with your target audience and helping you, the researcher, to shape your research in ways that are going to make it more amenable to that final translation.
Okay, all right, that's very helpful. Thank you.
Okay, Tracy, do you have a question that you would like to direct to one of our speakers or another panelist?
Well, I was trying to think. There were so many comments made. I think just in general, for us coming from the rural context, just population-wise, our network is smaller, and it can be challenging to use some of these newer, innovative ways of connecting with people, such as what ePolicyWorks presented. And so I guess we have our experiences in really doing the rubber meets the road, using the constituents and the stakeholders in our rural areas, and even across the nation. So I wonder if there is any advice or recommendations on how to better integrate technology and reach out to the rural communities to use those advantages to technology.
Hi, this is Katya. I think that Hope and I can maybe address that question. We actually had a group out of St. Lucie County where we did a national dialogue, a local dialogue with the transit authority there that was looking to reach out to the veteran community, and the veteran and military community, to find out what they could be doing to improve transportation services for that specific community. And one of the biggest challenges we found was that they didn't think, they being St. Lucie County, that the stakeholders they were trying to reach had access to the internet, to actually participate in the dialogue. And they were also so used to doing things like paper surveys that they really had to take a better look at how, or a fresh look at how people were, accessing, various
tools. And to add to that, I think it was interesting because I think when we went through the process, we found that some of the things that were holding them back, that was making the new technologies difficult, were integrated in just the way they did business. Like, their website was never a priority for them, so it was hard. I think even though they got visitors, and it could have been a great resource for them, it kind of, I think because of funding and other things, fell to the back burner. So as part of the process, when we could point out that improving some of these other just, maybe not newer tools, but by improving the website, making it cleaner and easier to use for your constituents, then we could promote some of the other tools. And we did use, to reach them, libraries, some of the old ways to integrate the new tools into the old process. So we connected with the libraries. They had a weekly TV show on local access TV that they used to kind of reach out and encourage people to use the dialogue. So it was kind of looking at the whole process, I think.
And one of the
I
things,
would add for our,
perhaps, as Hope mentioned, we teamed up with the local libraries there because they have computers and internet access available to use the tools, but also we understand that not everyone has internet access, but just about everyone now has a mobile phone. So text-type communications are really popular now, and also the use of smartphones. So that's why it's really important that the websites were mobile friendly, and so we could teach people how to use their mobile devices to access these dialogues.
I was going to say for veterans in particular, where unfortunately the signature injury now from the Middle Eastern wars has been post-traumatic stress disorder or traumatic brain injury, increasingly these combinations of text, sound, visual, usable strategies will become important, particularly in a mobile venue.
Yes, and we also found that a lot of the healthcare providers, specifically the VA hospitals, were using mobile devices to communicate with their patients. So we were able to tie in. This was a new way that they were being communicated with for their health care. Now, they could also receive these types of communications with for their transportation needs, and also not just to receive information, but to participate and also provide information.
Well, thank you very much, everyone. I wish we had a little bit more time, but as you know, we are running a few minutes late already. So I think we'll move ahead and we'll wrap up this session. And Kathleen Murphy will come back and give us a few words of what to take away from our session today on policymakers. And then we will move on to a larger break. It was originally scheduled for 40 minutes. It'll probably be about 35 minutes. We will go ahead and start our next session on time. And so Kathleen, please take it away.
Okay, thank you, Joanne, and thanks so much to our panelists, Peter Blankmer, Amanda Lewis, and Tracy Baim. I really appreciate all of you clearly took the time to review the slides that we sent to you, both from our own and ePolicyWorks research, and so that ended up being really rich and thoughtful responses. I've tried to take notes and synthesize some of the key points related to the 4 questions that were posed. So I'll just touch on a few things. As far as what kind of assistance do policymakers need to help identify research and understand its implications, Katya and Hope gave us a really great example of a new technology, crowdsourcing, that helps stakeholders develop policy in new environments. And they talked about the increasing emphasis in recent years on transparency. And Peter Blank highlighted that it's not just transparency that's changing the tectonics of the policy landscapes, but we can be thinking about increasing interactions of domestic and international policy, the ongoing regulatory versus legislative domains, and then in that final dialogue he was having with Myrna, talking about the way policy goals themselves might overlap or compete, and so the importance of compromise there. So while crowdsourcing and other social media tools have such a huge potential for expanded citizen engagement that can connect some of these dimensions, and it was really heartening to learn that I think they're called trolls when people get on social media and make nefarious comments that they haven't been experiencing that. It does make me think, though, what about issues of rigor? And there are cross kind of landscape issues of translation that would need to go on, including researchers who may need to let go of their attachment to precision of measurement. Thinking about the policymaker research relationship building, John Tschida really emphasized the really great new opportunity we have to build new relationships. He talked about the Rehabilitation Research Advisory Council as being an obvious set of new stakeholders, and it also seems pretty obvious to me that KT itself and the more evaluation-oriented staff at the Agency for Community Living actually can, there's a lot of similarities there because both approaches to research are so outcome-oriented. And some key points about the dissemination formats, I'd refer everybody to slide 11 in ODEP's presentation, and thinking through our own presentation, selecting those tools carefully depending on your audience, which, as Myrna pointed out, may vary from recent college grads to PhD levels. So clearly there need to be hybrid forms of communication that incorporate personal stories, and then perhaps some of our interviewees talked about a 1-3-10 format where you have a 1-page with your bullet points, the 3-page executive summary, and then the 10-page longer report. But the discussion has also raised really important issues when we think about dissemination of accessibility, not only from the lens of disability, but from disenfranchised populations like those living in poverty and in rural areas. So finally, thinking about factors essential to promoting research uptake, I think Tracy did a great job of pointing out how early and often, we've already discussed in the question that Myrna had, it is to engage whoever you want to be involved in your research process. And she also implied that there perhaps is a new model of research that focuses on teams who have a variety of skills rather than the lone scholar. And as Myrna pointed out, whether the lone scholar or the team, you need to establish yourself as trustworthy and really build those relationships with frequent bits of communication, which I think Katya and Hope's final point, one of those pieces of communication should always be closing that circle once you've engaged someone in your process, to make sure you go back and explain how you put their engagement to use.